Dive in, talking about the government shutdown during our 3 to 4 o'clock hour. We discussed the government shutdown, some of the broader topics with Dr. Bitzer a little bit earlier. So if you do want to go back to that, you can find that on our WCNC Plus app. The same way you're watching this, you can find that portion of our discussion that we had today. So we're going to go into a little bit more depth about what this means. A lot of Democrats have talked about the ACA subsidies and how that was tied to this new bill that was not obviously passed, which has led to a government shutdown. So we did talk to Dr. Ciara Zachary from UNC Chapel Hill to get more information on what's going on behind the scenes. Let's listen in. All right, everyone, here on Impact News inside the WCNC Plus studio, we have PhD Dr. Ciara Zachary here from UNC Chapel Hill. Ciara, thank you so much for your time. We were talking a little bit earlier, a little bit about the conflict between obviously the Democrats and Republicans, really as it relates to the Affordable Care Act, and that's kind of the main focus of the government shutdown. We did discuss, some of the big aspects of the government shutdown and the big agencies that could be impacted earlier with Dr. Michael Bitzer from Catawba College. So if anybody wants to go back and look at that, we do have it for you on WCNC Plus. But Dr. Zachary, I did want to ask you, these subsidies, I don't know if people know this, but subsidies usually make things cheaper for folks to be able to afford them a little bit easier. And that's what the Democrats had been saying, that they wanted these subsidies to continue, which expired on the 30th, which was just yesterday. And I do want to run through a little bit about these because the extension, it was part of the continuing resolution that the Republicans wanted to pass. They didn't want it tied to the budget moves, obviously being discussed, but they were able to get this. So what does it mean for most Americans? Because I don't think people realize this could affect more than 20 million Americans. So just in layman's terms, what are subsidies in relation to the ACA, and how many people could be impacted, and what does that look like?
Yeah, first, thanks for having me and for wanting to cover such, a hot issue, but it's also complicated. And as you were saying, it impacts the lives of so many of us and so many in North Carolina. So just to give a little bit of a historical context about the Affordable Care Act, premium tax credits, subsidies, financial assistance, however you want to say it, have always existed for individuals or households that have sought to get health insurance through the ACA marketplace. What happened is during the Biden administration and during the COVID pandemic, there was first the American Rescue Plan Act that said, you know what? A lot of folks, this is a pandemic, a public health emergency. A lot of folks need their health care. People's job statuses are changing. We need to increase the amount of financial help people are able to get so that they can continue getting their health care in these uncertain times. So those were called enhanced premium tax credits or subsidies. And with the Inflation Reduction Act, those subsidies were extended until the end of this calendar year, 2025. So they're set to expire. And so what we expect is that if these enhanced subsidies expire, people are going to see a change in how much their health care costs in the Affordable Care Act. So with these enhanced subsidies, some folks, depending on their income level, were receiving fully subsidized health insurance, like not paying anything for a premium. And historically, people who made over 400% of the federal poverty level did not get any financial help. But with these enhanced subsidies, even those folks were getting help. So depending on where you are, you might feel more of a crunch. I think folks with lower incomes will continue getting some financial assistance. It just won't be as much. So we all know we have lots of competing priorities, and this just might make it harder for folks to be able to put groceries on the table and also be able to continue buying their health insurance.
Sorry, I wanted to ask you if possible, as you said, in every case, it's going to be different. But I was just reading that the average that could be projected for the rise here could be 114%, which that's a lot. Sometimes I go by the thought process, and I think this is a Jay-Z line: "Don't buy something if you can't buy it twice." Right? So I just think about that. If you have something that's going up 100%, that's going to impact households a lot. I mean, even those people who are in middle class, because we've seen, even middle class Americans squeezed over the last couple of years more so than almost anyone else. Obviously, lower income folks are in that as well. How do we put that into layman's terms for folks to really understand how this could impact people going ahead, especially into 2026, because inflation still is not tamped down. I mean, we've seen Fed Chair Jerome Powell discuss where they want to go, and much different from where the administration sees. We won't discuss that, but can you put into, like I said, layman's terms, 114%, what that looks like for people?
Yeah, so 114%. So let's just do this, like there's a report from the Commonwealth Fund, and they're saying like a household of four, let's say their annual income is about $47,000 a year. They may see an increase of about close to $400 more to purchase their premiums. Someone who's, a household that is, making over $100,000, they may see, an increase of a few $1,000s more. So as you said, like this is big sticker shock. Like people will be, we've gotten comfortable to paying a certain amount. We know that prices are going up on many, things that we need just to live comfortably. So seeing this sticker shock, unfortunately, there are some reports saying that at least 4 million people across the country just might say lose their insurance. And then others may just have, just tight financial squeezes. And we know that, some economic changes have been impacting lots of households.
Yeah, and that's astonishing to think about, because that could be nearly 26 million individuals if you add the 4 million you talked about losing coverage potentially, and the 22 million others who are going to be squeezed receiving these, or could not be receiving these enhanced subsidies. So some interesting things that will go ahead of this. Anything else, Dr. Zachary, that you think should really be discussed in this, and for folks to really, because like I said, this is a discussion that I think either side has real trouble really keying in on, and I think communicating to the public how this could impact. The Democrats sometimes seem to fail with words in that way, I will say. So it is good to put this, like I said earlier, in layman's terms for folks so they can understand it, because $400 for anyone, that's going to be a huge impact, especially if you have kids nowadays. I mean, that could be impacted as well. So anything else we're missing?
Yeah, I think, overall, we have seen that these subsidies have been nothing but a benefit to, and has expanded how households, even no matter what their income level, can access healthcare, which we know is always a financial concern for people. And these enhanced subsidies, have grown the enrollment of the marketplace from about 12 million people in like 2020 or 2021 to now we have like 24 million people that were able to, really benefit from these enhanced premium tax credits. And so I think the health of individuals is not a red or a blue issue. It's just, how we care about our neighbors and our communities. And so we want to make sure that people can still get health care so that they can continue to work, they continue to go to school, they can continue to worship and play. So I just think this is important. And I hope that folks can continue accessing affordable health care.
Yeah, everyone should be able to access affordable health care to take care of themselves and their families. Absolutely. Dr. Zachary, thank you so much. She's an assistant professor at UNC Chapel Hill, Department of Health Policy and Management. And Dr. Zachary, thank you so much for your time and for fielding our questions. We certainly appreciate you.
Thanks for having me.
Thanks.